Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well crafted summary and it highlights only the important keywords. Antifungal drugs, and this will be part 3 where we are totally going to classify it. So let's look at classify, and we are also going to look at the azoles. So first, the classification of antifungal drugs. It contains the azoles. Under azole there can be ketoconazole, there is miconazole, there is clotrimazole, fluconazole, itraconazole, voriconazole, posaconazole, and the asavuconazole. Next is alliamine. So alliamine is nothing but the drug terbinafine. So alliamine is terbinafine and polyene antibiotics. Polyene antibiotics, the classification, it includes amphotericin B. Amphotericin B, nystatin, amycin, as well as crisaphlorin. Then comes antimetabolites. Antimetabolites, it includes the flucytosine, then echinocandins, it includes the caspofungin acetate, as well as the micafungin. Then looking at other topical agents, this includes the Whitfield ointment, toinaftate, sodium thiosulfate, selenium sulfide, as well as D-silenic acid, as well as butanafine. Now we will again go to the azoles mainly. So in terms of azoles, let's also discuss azoles. So mechanism of azole is that it inhibits the fungal steroid synthesis. It inhibits the fungal steroid synthesis and results in the damage. So it causes damage of the results in damage and leaky cell membrane. What are the uses of this azole? The uses, it is used for systemic mycosis. Systemic mycosis, there are presence of broad spectrum. There is broad spectrum, that is Candida, Cryptococcus, Blastomyces, Coccidioids, Aspergillus, Histoplasma, Mucor, and also it contains the tinea infections. Next is ketoconazole. Ketoconazole is topically ketoconazole. So ketoconazole, where is it used? It is topically used in shampoos. Ketoconazole is used in shampoo for treating the dandruff, and systemically they are given orally or even to treat the Cushing's disease. So ketoconazole used for dandruff as well as Cushing's disease, as ketoconazole inhibits the steroid synthesis. Ketoconazole, as we discussed, it inhibits the steroid synthesis. Next, moving on, we look at the other causes. Is it can cause the ketoconazole, it can cause gynecomastia and the microsomal enzyme inhibitor. Now looking at itraconazole. Itraconazole is most preferred drug in case of systemic mycosis and can cause hypokalemia as well as hypertension and the edema. Next is voriconazole. Voriconazole is nothing but DOC. It is for the invasive aspergillosis. And what is adverse effects? The adverse effects of voriconazole is that a patient may experience visual and auditory hallucinations. So voriconazole is a drug of choice in case of invasive aspergillosis. Adverse effects, it includes visual as well as auditory hallucinations. Then comes the pasaconazole and the isavuconazole. So these are nothing but long acting. So they are long acting, they are useful in resistant cases. So they're used in resistant cases. It is effective against the mucormycosis. Now we look at topical azoles. So these topical azoles are mainly for the fungal skin infections, and cotrimazole is most commonly used. Cotrimazole is used, and others like miconazole, iconazole, and the oxyconazole, they are used. To learn and grow daily like this, please do subscribe.